We talked about the foundation principles of concealment in part 2 and how to make your gun conceal under scrubs without printing. But no setup is ever 100% perfect, so in this section, we're going to talk about visual and social camouflage techniques that'll help to support your concealment basics. The first visual camouflage tactic is super easy. Just tuck in a tank top or a camisole over your gun. Not only does it slightly smooth the outline of your gun and prevent your clothing from sticking to it, it also protects you from being spotted if your shirt happens to ride up. It's not going to make your gun completely invisible, of course, but it will make it harder to determine at a glance that you're carrying a gun, especially if you choose a dark base color and a matte fabric, which tends to absorb light and reduces the visual impact of a gun. Tucking a shirt over your gun shouldn't really affect your draw time that much because when you clear your cover garment, you should be grabbing tight enough to clear both garments at the same time anyway. You do definitely want to practice this regularly. Next up is scrub selection. And you know, if you work in healthcare, you don't always get to choose your scrubs, you don't always get your choice of colors or fits, and sometimes you don't get any choices at all. If you do buy your own scrubs, of course, you can choose concealment-friendly styles. Choose tops that draw attention away from the waist, like interesting necklines, patterns, interesting sleeves, or different cuts that draw the eye up away from your waist rather than down. Sometimes your scrubs are provided by the hospital and you don't have a choice. And in that case, just make sure you get an appropriate size to fit you and make sure that they're sized big enough to take advantage of some of that fabric drape. Obviously, you don't want to look sloppy, but you want to have enough room to avoid giving away the fact that you have a gun. You can also try positioning your gun behind a pocket, using that extra layer of loose fabric to visually disguise any trouble spots in your concealment. If your department policy allows it, add interesting pieces of flair. Or different hairstyles, makeup, or jewelry to draw the eye up to your face. It also helps a lot to wear your name tag up at your neckline instead of down at your waist. The next thing I want to talk about is social camouflage. When we talk about concealment, the visible signature of the gun is really only half the equation. There's a whole second aspect to concealment that's all about perception. How can you tell someone is carrying a gun? You maybe notice a shape that doesn't belong, like a corner where there should be a curve, or a line where it should be smooth. Your brain takes that visual input and interprets it along with other context cues, and makes an educated guess about what that object is. Is it a gun? Is it a phone? Is it a back brace? Is it a sandwich? A big part of having good concealment has to do with influencing those context cues and social factors and making them go in the direction you want them to go. People's perception is heavily influenced by what they expect to see or feel, so proactively managing their expectations helps shape their perception. You want to make it so that when people look at you, they don't jump straight to gun if they notice something odd. For example, a little weirdness in somebody's clothing drape is a lot less alarming if you've already noticed that they have a back injury or that they're wearing a medical alert bracelet. You still see the odd drape, but instead of thinking gun, your brain plugs that information into where it seems to make sense. So if you look like an off-duty cop, they may plug that odd corner into the gun spot of the brain. If you look like somebody's grandmother, they might plug that same info into the insulin pump category instead. While you can't change your physical attributes, you can change your style, your mannerisms, and your body language to conform to what people expect to see. How you do that is going to be really individual, but it's definitely worth thinking about. What cues can you give to lead people to easy assumptions? When you're standing around in the hallway, do you look like you're standing at parade rest, or do you look relaxed and natural and non-threatening? Also, think a little bit about being proactive. When you're in a challenging concealment scenario, what kinds of proactive things can you do to focus people's attention away from your gun and towards where you want it to go? So, for example, say you need to stand in front of a patient in a wheelchair and help them to stand. Are you going to just stand there and let them stare at your waist? Or are you going to talk to them about where you need them to go and use your body language to direct their focus to the task you need them to do? Being proactive and managing expectations takes practice, confidence, and self-discipline. If you're afraid that you're printing, your first instinct might be to reach down and adjust your shirt, but people's eyes tend to follow your hands, so bringing your hands down to your waistline will actually make them more likely to notice you. Instead, what you want to do is practice small mannerisms and hand motions that draw people's eyes up to your face. If you reach up to adjust your glasses, for example, most people's eyes will follow your hands up. And if you become adept at redirecting attention, your overall concealment is going to improve. One of the absolute best ways to socially camouflage your gun is to make interesting conversation. Show genuine interest in your patients and your coworkers. If you can engage people in a great conversation, their attention is going to be on the conversation and not on what you're wearing or carrying. The last thing we're going to cover is how to handle physical touch. The nice thing about appendix carry is that your gun is almost always within your field of view. And it's also not socially acceptable to touch other people's stomachs or groins, and hugs generally don't involve hip-to-hip contact. For patient contact, being proactive really helps. When you lift or transfer a patient, proactively manage where their arms are going to go. Tell them where to hold on to prevent them from grabbing you around the waist. And if they can't communicate verbally, use your body language to direct them as best you can. Whenever you can, make sure your patient has something to hang on to, like a walker or railing, so they don't try to grab you for balance. And this is best practice anyway, both for your safety and theirs. But it also helps with your concealment as well. Think one step ahead and keep their attention focused one step ahead instead of on you. With physical touch, again, being proactive and having a plan helps a lot. You want to have a plausible explanation for what people might be feeling if they bump your gun. One thing you can do is carry objects in your pockets that you can highlight if somebody bumps you. If you think a patient may have bumped your gun, you don't necessarily need to say anything to them. Sometimes just pulling your phone or pager out of your pocket and checking it will provide enough of an explanation for what they've felt to influence their perception. Just a word of warning, though, if you do carry objects in your pockets, just make sure they're not going to make noise if they do end up hitting your gun. With social camouflage, keep it light, keep it easy, and keep it plausible. You don't need to invent elaborate lies. You just need to make it easy for people to make the assumptions you want them to make. So keep your redirections simple, manageable, and as close to the truth as possible. All right, so we've gone all the way through risk assessment to concealment fundamentals to practical advice for carrying at work. And now all that's left is to practice your concealment skills until you achieve confidence. Confidence doesn't just come from time. Confidence comes from quality time. So practice these skills until they're second nature, get really confident in your concealment, and go out in the world and be safe. Thanks for watching.